that very resourceful and insightful talk with those slides, we move on to the last leg of the session, immunization for diabetics by Dr. Rama Subramanian. We classically only look at selective immunization. Let's see what he has to add on.
Good afternoon, everybody. I'd like to thank Dr. Vijayakumar and Dr. Raman for the invitation today and give you a brief overview on the necessity for immunization for diabetes. Before I start, just a show of hands, which I always like to do. I want those people who have had any vaccinations in the last 6 months to raise their hands. Any vaccinations in the last 6 months? I see about who have had any vaccination in the last 6 months. I see about 20, maybe 25 people raising their hands. Okay. Now, it is very clear that diabetics are at an increased risk of developing infections. There is a close relation between hyperglycemia and infections. Infections can result in hyperglycemia and vice versa. And it has also been shown that diabetics are at an increased risk of developing respiratory infections specifically. In fact, studies have shown that diabetics are 6 times more likely than non-diabetic patients to be hospitalized during the influenza outbreak and 3 times more likely to die of pneumonia or the flu. The death rates are about 5 to 15% higher in diabetics during flu epidemics, and the case fatality rate is also high, about 12% for the flu, and for pneumococcal infection it can be as high as 1/3 of patients. So it is well accepted in general diabetics have a higher complication rates for infections and probably a higher possibility to die of infections when they suffer and get hospitalized. Now I will cut to the chase and give you the recommendations from the advisory community on immunization practices. I think there is no longer any doubt that adults also require vaccinations. We have so far been having the idea that children definitely do vaccinations. It saves lives, prevents vaccine preventable diseases, but it is now very well accepted that adults also require vaccinations. This is either as a booster for the vaccinations you've had as a child. This is maybe for certain infections which only adults are likely to get. And just like you recharge your cell phone batteries, just like you wash your clothes and change, you do require boosters in the adult agehood also. And this, which is accessible on the net, very clearly tells what are the vaccinations. This is the 2019 recommendations on what vaccinations we need based on the age. But the same advisory committee also has come up with very good guidelines on what vaccinations patients with certain comorbidities require. And you'll see very clearly that diabetics require almost several of these vaccinations, which I shall highlight in the next 5 minutes or so. What we need to learn is how we can customize it to our Indian population. The first is the influenza. Till about 10 years ago, we were not very clear whether flu used to come to India. We were thinking that the hot temperatures in Chennai would prevent the flu from causing problems, but we very well understand that flu is here to stay, and it is not only during the winter months. I doubt whether we have a winter in Chennai, but at least it is not only during the November, December, January months. You can get outbreaks even in the peak of summer during April and May. It has been suggested that all persons over the age of 6 months of age require to have the flu vaccine, and very clearly people with medical comorbidities, you will find in the second category patients at highest risk. And under medical comorbidities, diabetics are also at a higher risk and they do need vaccines. But what is surprising is the flu vaccine not only prevents or protects us from getting the flu, or even if we get the flu, it attenuates the severity of the flu. It has also been shown that the influenza vaccine reduces hospitalization for cardiac disease and strokes. In other words, flu is believed to cause an inflammation in the blood vessels, which can lead to vasculopathy, leading to an increased risk of strokes and cardiovascular events. And by giving the influenza vaccine, by preventing the flu, you can protect the person from cardiovascular and cerebrovascular events also. There is in fact a lot of evidence that flu vaccine is associated with a reduced risk of acute myocardial infarction, which diabetics generally are more prone to develop. It has also been shown that there is an association between flu vaccine and cardiovascular outcomes in high-risk patients. So there is a lot of evidence to suggest that the flu vaccine not only prevents the complications and morbidities associated with the influenza infection, but is also acts as a protective agent in cerebrovascular and cardiovascular severe outcomes. There are two types of flu vaccine mainly available. You have the inactivated, which is the parenteral dose of flu, which most of us have. There is also a nasal vaccine, which is a live vaccine. The nasal live vaccine is not indicated for people who with immune compromised status or pregnant women, but for all other people you can take either the nasal or the inactivated intramuscular flu shot, and both, at least in this year, have been found to have the same efficacy in preventing or protecting against the flu. These are just for your information. Currently, we no longer use the trivalent flu. At least from this year onwards, we should be getting, for all the vaccines, should be a quadrivalent flu. Each flu vaccine contains 2 influenza A serotypes and 2 influenza B serotypes, which have been found by the WHO to be the common circulating varieties, which will provide immunity against the 4. There is a northern hemisphere vaccine and there is a southern hemisphere vaccine. Sometimes they both happen to be the same, have the same content, but sometimes there is a slight difference. And this is the flu vaccine strain which is recommended for the coming 2019-2020 flu season, which starts usually around September, October of every year in the northern hemisphere. This is the northern hemisphere vaccine. We have at present, even though the earlier northern hemisphere vaccine for the 2018-19 season is probably going to expire in June, we have the southern hemisphere vaccine which is currently available, and the recommendation for a tropical country like India is, at any point in time, if you have not had a flu vaccine in the previous 1 year, take the available flu vaccine which is available, whether it is northern or southern hemisphere, and especially so for diabetics. The second infection is a pneumococcal disease. India has a very high burden of pneumococcal disease. And what is surprising is that pneumococcal disease, especially the invasive variety, has a close correlation with certain underlying comorbidities. In fact, patients with diabetes are probably more than 6 times at a higher risk, a 6-fold risk of developing complications of invasive pneumococcal disease. And you will see the other complications, other comorbidities which are associated with an increased risk of invasive pneumococcal disease. Not only that, as you grow older, there is a closer risk of developing invasive disease. So a diabetic between 30 years and a diabetic of 60 years, the person at 60 has a much higher risk of developing invasive pneumococcal infection. Again, not only that, other comorbidities like, say, heart disease or lung disease are also associated with an increased risk. So much so, a diabetic over the age of 50 who may have underlying heart or lung disease has a high possibility of developing significant invasive pneumococcal disease and its complications. So keeping this in mind, and also the fact that there is a link between influenza and pneumococcal disease. You know that a flu can predispose to a subsequent bacterial pneumococcal pneumonia. So with this in mind, the WHO has very strongly recommended that all persons with comorbidities, I'm only highlighting the diabetes, apart from that, of course, any chronic organ failure like heart disease, lung disease, nephrotic syndrome, alcoholic liver disease, bronchial asthmatics, all of them require a pneumococcal vaccine. And especially, as I said, if the diabetes is growing older with other comorbidities, the indications are, of course, much, much stronger. The American Diabetes Association advocates pneumococcal vaccination for all people who have been diagnosed to have diabetes. It is still not clear at what time would you give. Would you give him as soon as he is diagnosed at the age of 30 maybe, or would you wait till 50 to give him? Would you give a person who has a higher possibility of uncontrolled diabetes as a more prime candidate? These are not yet clear, but the recommendations are that a person, at least in India, where the government does not give the vaccine, if he can afford the vaccine, apart from controlling his sugar, apart from controlling his cholesterol, it is very essential that he be offered the vaccine for pneumococcal infection also. There are 2 types of pneumococcal vaccines. You have a polysaccharide vaccine and a conjugate vaccine. Children are generally given the conjugate vaccine. In general, anybody between the ages of 19 and 64 with conditions like diabetes, a polysaccharide vaccine 1 dose is recommended. If the same person is over the age of 65, then with diabetes or without diabetes, ideally a conjugate vaccine followed 1 year later by the polysaccharide vaccine is advised. So I repeat, any adult diabetic less than 65 years requires only a polysaccharide vaccine, but over 65 years, he requires a conjugate vaccine followed 1 year later by the polysaccharide pneumococcal vaccine. The third vaccine is hepatitis B vaccine. Again, the American Diabetes Association very strongly recommends to prevent hepatitis B, a vaccination for all unvaccinated adults with diabetes younger than 60 years of age is recommended. So in India, hepatitis B has become part of the universal program for immunization for the last about 15 to 20 years. But others who are maybe over the age of 30, diabetic, it's strongly recommended they be given 3 doses of hepatitis B vaccine: 0, 1 month and 6 months. The current recommendation for antibody testing for post-vaccinated hepatitis B vaccinated individuals is have antibody titer checked 4 to 8 weeks after the 3rd dose. If the titer is more than 10 international units, they are well protected. They do not require any subsequent boosters. This is same for healthcare workers also. So one value of more than 10 international units after 4 to 8 weeks after receiving 3 doses of vaccine is all that is required. Further testing is not required. A word on herpes zoster. There is a strong correlation between herpes zoster and the occurrence of cerebrovascular accidents, usually within 6 months to 1 year after a person develops herpes zoster. So all adults over the age of 60, especially diabetics, are strongly advised the herpes zoster vaccine. There are currently 2 vaccines which are FDA approved. The Zostavax, which was available in India, unfortunately for the last almost 7-8 months it is not available in India, is recommended. That is a live vaccine. There is also another new vaccine called Shingrix, which is available in the US, which is not yet available in India. But hopefully in the next 6 months or 1 year, we should have both vaccines available, and diabetics are strongly recommended because of the vasculopathy to have a herpes zoster vaccine after the age of 60. So the vaccinations which are generally recommended is summarized in this slide. All diabetics require annual influenza vaccine, a pneumococcal vaccine depending on the age. If it is less than 65, it is a polysaccharide vaccine. It is more than 65, a conjugate followed 1 year later by a polysaccharide vaccine. Hepatitis B vaccine is also recommended. Tetanus diphtheria booster. Again, all diabetics, not only all diabetics, all adults require a booster of tetanus every 10 years. And currently, even the government has given away with the tetanus dose. It is recommended a tetanus diphtheria combination is given for everybody at 10-year intervals, at least one of which should be a tetanus diphtheria pertussis shot. Similarly for pregnant women also. And any other vaccinations like either chickenpox or typhoid or hepatitis A, if they have not had the infections before, diabetics should also be given these vaccines. But, I'm sorry, this has gone off. When you look at who influences a person or a patient getting a vaccine, it was shown that the most important influence, about 65% of patients got the vaccine because their doctor recommended it to them. In other words, the most important reason for a diabetic patient to be vaccinated is the doctor. No. So, which means that unless physicians recommend their patient or offer their patient the vaccination, the patient is not likely to be vaccinated. And we all realize that out of this audience of maybe about 200, 300 people here, only about 25 have been vaccinated. Unless you are vaccinated, you are not going to offer vaccination to your patients. So as Gethe said, that one of my favorite quotations, knowing is not enough, we must apply. Willing is not enough, we must do. So knowing that vaccinations benefit patients, especially diabetics, is not enough. And I would like you to start with making vaccinations attractive. So this one says almost 69% where the personal physician was responsible for the patient getting the vaccine. So unless we recommend, I don't think this is going to happen. And as I said, Gethe said, knowing is not enough, we must apply. Willing is not enough, we must do. So it is high time we realized the fact that vaccination should be made more attractive. Always now we look at as what are the complications of vaccination. We never ask what are the complications of an anti-diabetic drug or an anti-hypertensive drug. But when somebody says vaccine, oh, will I get Guillain-Barré syndrome? Will I get encephalopathy? No, these vaccinations have now been found to be very safe and there is no risk apart from maybe local reactions. So I will leave you with this slide that vaccines do not save lives. Vaccinations do. Thank you.